My name is Mel Butterfield, and I'm the Assistant Director for Youthline, our crisis help and support line for youth, where peer-to-peer we train youth volunteers to answer calls, texts, chats, and emails from youth across the nation and globally. We are so pleased to have Senator Wyden in our office today talking with youth and some local practitioners about the current and very obvious needs to address some mental health, not only here in our current area, but across the nation. So I would love to have Senator Wyden come up and have some discussions with some of our folks about what they've been talking about today.
All right. And Mel, thank you for the incredible work that you all do here day in and day out. It's so appreciated. And for the press, you should know that we're all observing the campus rules with respect to masks on campus. So that's why we're not even for presentations at the podium. Here's how we're going to do it. I'm going to make this a filibuster-free zone. So I'm going to give real short remarks, and then we're going to hear from Molly Bean, a practitioner who can tell us about some of the challenges that she's seeing here in the community. And then we're going to have three students, Trace, Jordan, and Clea, talk about what they're experiencing on the lines. And I just so appreciate all the student volunteers for their incredibly important, life-saving work. And I think that the students and all the volunteers, you all are the best of the Oregon way. You know, pitching in, helping, standing up for your friends and classmates. And I think everybody understands that for a lot of young people in Central Oregon and across our state, the pandemic has just taken an enormous toll. I was just told by the students and the practitioners that the waiting lines have been incredible. There's a program at St. Charles, one that is very widely respected. The PEDAL program, where the waiting lines are months and months. And suffice it to say that if you were a young person before the pandemic, there were plenty of challenges. Now what the students are telling me is that on top of the challenges they had before the pandemic, so many additional stresses are what they're dealing with, and that's really taken a toll on our families. And this is certainly backed up by the national figures. The Centers for Disease Control said during 2020 the proportion of mental health-related emergency department visits among young people between 12 and 17 increased 31% compared with 2019. And as the brother of a man who battled schizophrenia his entire life, this is deeply personal to me. I so appreciate all of you doing this incredible work, and I'm making mental health a lodestar for my time in public service. And I'm just going to, wrap up with two other quick points. First, we're really proud to have been able to work with you on the 988 suicide hotline. Very pleased that the CAHOOTS model is going to be going into effect around the country. Our historic agreement between mental health advocates, law enforcement people, $1 billion through the Medicaid program starting next year. Glad to have worked with all of you on that. And now, when I turn this over to Ms. Bean, I also want to take note of the fact that the Finance Committee, where I'm the chair, is working on a bipartisan effort in terms of shoring up mental health, with particular focus on trying to get more specialists that we need, clinicians to assist, and more opportunities for young people to get services more quickly, because it seems to me these waiting lines are not an abstract issue. This is a question in many instances of young people simply saying to themselves, nobody is out there for me, and that's just unacceptable. So There's a bipartisan effort in the Finance Committee. As soon as we're done with the Build Back Better legislation, we're going to move on mental health, and that's why the students and the practitioners have been so helpful. And at this point, we're going to hear from Molly Bean, and then we'll have Trace, in this order, Trace, Jordan, and Clea, my three students, to give us, I know, very valuable presentations. And let's go with Ms. Bean. All right.
Where would you like me to?
Well, you get the podium. It's yours.
Oh, lovely. Are you ready? Okay. So we're just so grateful that you're here and bringing attention to some of these issues. We've been having a real shortage and struggle with getting people into quality and experienced clinicians for a long time in Central Oregon and in areas outside of Central Oregon as well. It seems as though throughout the pandemic, because of people having to take fewer clients due to being at home with their kids, or just due to the acuity and the amount of clients that are coming in, the longevity that people are staying in services, there's a lot fewer openings right now, which is making it challenging. People are calling 30 people that are approved by their insurance and not getting any calls back. Or they're saying, I have this insurance, but I know a lot of people aren't billing it, so I can do cash pay, which can be $100 and $150 a session, which is a huge barrier for an individual. It's creating yet another divide in who has access to services and who doesn't. And it's creating a lot of frustration. So people are experiencing higher levels of stress, worry, sadness, which is making it so they're in services for longer, they're needing more services, and yet there's no availability.
Sums it up.
Yeah.
The gap between need being up here and practitioners being here just keeps growing. Well said, Ms. Bean. Okay, Trace.
Cool. Yeah, I mean, I totally agree with all of the points that Molly brought up. And I think it's important to note that kind of those accessibility and kind of just overall like being able to afford, mental health treatment, some of those barriers are really intensified in rural communities. And I think, it's super important that we fund infrastructure, like support infrastructure that really provides some of the technical support that so many people in rural communities need. There's definitely that urban-rural divide, and I think, at least my experience in living in a rural community and kind of seeing those similar experiences reflected with the people I talk with on the lines, super duper important that we are really aware of the fact that some of these barriers are intensified for rural communities, and really funding youth in those communities, super important to me. So yeah.
Well said, Trace, and particularly the last thing Oregon needs are more kinds of issues that suggest there's an urban and rural divide. And I've had 970 open to everybody town hall meetings, and I want to do more to reduce that divide. And well said. Let's go with, I think we're going to go Jordan and Clea now.
I think Trace made some really good points about like the urban-rural divide, and then like addition to that divide, the pandemic has created a divide between seeing people in person. A lot of places are like offering like telehealth to Zoom meetings for counseling, and I think that can be really helpful. But I also think that like as those people get like swamped with clients, it makes it more difficult to have a meaningful interaction with somebody like via telehealth or Zoom. And especially for teenagers, because oftentimes, like, in pre-pandemic times, you could maybe talk to a school counselor or you could go to a counselor yourself. But with COVID, it puts up that barrier, and you have to do things from home, online, and some parents aren't supportive or don't understand, like, how that affects you, so that creates a barrier between, like, teenagers getting the help they need, which I think is really important, because we do have a lot of stress, like, nowadays. And there's a lot of unrealistic like standards that teenagers are expected to meet. So in it, like increasing that stress and then not having the resources to help like fight that or like keep you above water makes it just like really difficult with the pandemic. So.
Well said. Well said. Clea.
And then to add on with what Jordan was saying, it's really hard for teenagers to get the accessible mental health they need, that they need. And it gets really difficult because they have these barriers with their school counselors. Like, they feel like school counselors are only there to change their schedules, to, show them around the school. And really, like, they need to have real therapists, real counselors implemented in our school districts to help with those mental health needs that the students require, because they can't talk to anyone. Like, they don't, like, some of them lack a good support system, like parents or other trusted adults, and they don't want to go to their school counselors because their school counselors could also tell their parents, like, like what their student is going through. So then if we had the real counselors and therapists, it would be really beneficial to
On the school campus.
Yes,
so
on the school
convenient
campus.
And people can know it's actually going to happen. They're not going to have to travel.
Yes, it needs to be more accessible to students who need it.
Yeah, well said, Clea. Okay, press, any questions?